The Moving Massachusetts Upstream, or Mass Up investment program, funded 4 partnerships between hospitals and community-based organizations to focus on 2 major categories of social determinants of health: economic stability and mobility, and food systems and security. One awardee, Haywood Hospital, partnered with community organizations and local government in Winchendon to empower the residents and to promote economic stability, diversify community leadership, and create a robust local food system. This program is called Heal Winchendon.
The thing I love most about Winchendon is that it's a community where if anybody needs something, people come together. At the same time, it's seen a lot of economic devastation because of unemployment and the closing of the mills. In Winchendon, we don't have a grocery store. We're a food desert.
Everyone deserves hot meals with dignity, and everyone deserves to be able to nourish themselves. Nobody should go hungry.
Social determinants of health are the circumstances in which we are born, grow, live, work. Social determinants of health have a much bigger impact on the health of people than their genetic code or even their access to healthcare delivery services.
I've been working in public health for a long time, and the work that we did always involved education and programs and how individuals can change their behavior. The Mass Up investment moves it more upstream, where our people are living and how that impacts health.
With this core focus, HPC funded the 4 initiatives of the Mass Up program.
Initially, HEAL started off as healthy eating, active living because there was a high disease burden in this area. And then after working one-on-one with the residents and getting their feedback and taking a step back, you can't just address one area.
HEAL stands for Hope, Empower, Access, and Live. And the HEAL Collaborative is structured under 3 gears: economic empowerment, healthy food access, and social inclusion. Those 3 elements of change really are interdependent on each other.
I started working in hospitality, opening luxury casinos and restaurants across the country, knowing that people next door in these communities didn't have access to healthy food, yet we're serving it 5 feet away. It's not right. We need to do something about it.
With everything that HEAL does, we try to provide tools and resources from downstream to upstream work, meaning meeting people where they're at with immediate needs to addressing those root causes. We have the fresh boxes through growing places, and then we give them out for free to people. So we're reducing that food insecurity gap. And we're also working with some of the banking institutions to see what are their banking products, how can they be more accessible to people, looking at all the economic policies at play that are perpetuating poverty or making it harder for people to get out of poverty. And then even farther upstream, we're working with institutions to look at what is wrong with our food system, where are the gaps.
One key aspect of the Mass Up program is community engagement. Community engagement embedded within public health programs like this is essential for long-term success.
As an anchor institution, I think what excites us about the HEAL initiative is that we know we can't do it alone. Building trust with our residents, it helps us to understand our patient population, and it builds resources.
The HEAL Collaborative is governed by a steering committee made up of 5 youth leaders, 5 resident leaders, and 8 representatives of organizations. So all of these organizations, youth and residents, come together to make decisions and to govern and guide HEAL.
I grew up in this area. I'm a queer woman of color that's neurodiverse. I know what it's like growing up here, and it was difficult. And for a lot of us, there wasn't a space for us to exist in as our authentic selves.
It's amazing seeing people that never had a space for their voice to now be leading a makerspace or be on the town committee or be running a cafe.
I have seen youth really come into their own. I see people in our community feeling like they can come and be part of activities, maybe in places that they never were welcomed before. I've seen more civic engagement and involvement in our systems, in our local government.
One of the greatest successes of HEAL was to get Winchendon to work together. I think It's just amazing how the residents and youth are really the ones driving this.
Resident leaders in HEAL are uniquely positioned because they're members of the community. They're able to organize and gather people in a way that an outsider would not be able to.
I think it's important because all of the well-meaning, amazing leaders in our community, they still don't live here. They still don't have to see the ramifications of their actions. They still aren't as emotionally invested, no matter how big their hearts are, in the success of Winchendon and all the challenges it has to overcome.
There's been so many benefits. It has brought a greater understanding to the health system, what our residents face. So it's a two-way street. We can help to provide that backbone support, but also we're learning as we go along. And having that resident voice and engagement really helps us to do our work at the health system.
We've changed the course of Winchendon. People are working together, they're excited. There's just like a different feeling in town that things are possible.
I feel like through HEAL work, residents are more hopeful than they would have been in the past.
You really can change hearts and minds if you are patient enough, if you have enough empathy, and if you approach it in a smart way.